Hi, we're here with Dr. Binoy Ouseph. He's Beacon Medical Group gastroenterologist at Elkhart General Hospital. So, whether or not you were familiar with Chadwick Boseman, you've probably heard reports about the actor's secret battle with colon cancer, and he was only 43 years old. His death has put a spotlight on colon cancer, and that's why we're here today. Dr. Ouseph, what are the early signs and symptoms of colon cancer?
Well, the earliest sign would probably be rectal bleeding, abdominal pain, bloating, uh, any change in bowel habits. Sometimes you could have diarrhea or constipation, alternating constipation, diarrhea, anything that's different from your usual bowel habits, and the unexplained weight loss. Those will be the signs of colon cancer.
What is the survival rate and what difference does it make if it's detected early?
Well, if it's detected early, if it's a stage 0, which is polyp just involving the mucosa, it's almost 100% survival rate. Stage 1, 90% survival rate. Stage 4 really goes down to 11% survival rate.
So what this actor was faced with, I believe in 2016, he was diagnosed with stage 3 and then battled colon cancer through stage 4. So at stage 3, a diagnosis, would it be a little bit different? And again, different survival rate at that point?
Yes, definitely will be different. That's when the lymph nodes are involved, but it also depends on the type of tumor it is, the grade, how aggressive the tumor is, if the tumor is responsive to newer therapies such as immunotherapy. Even stage 4 can be treated effectively if the tumor is responsive to the newer therapies.
So has there been an uptick in the number of new cases? What can you tell us?
Well, the total number of cases, colon cancer cases have actually gone down. From 2007 to 2016, there's been a 3.6% reduction in the per year of the number of cases. But that's in patients over age 55. But in those patients under age 55, there's been an increase in incidence of colon cancer, up to 2%. Patients have dietary risk factors, more processed foods, foods. The younger people might have intake of foods with less fiber, more meat, red meat, fried foods, things like that. Also, younger people tend to kind of, discount the symptoms. Like if you have bleeding, they'll say that it might be due to hemorrhoids and ignore those early symptoms. Whereas older people, when they see blood, they immediately go to the doctor. So they've looked at studies where the time of from symptom to diagnosis in younger people is usually 271 days, whereas in older people it's like 30 days. So the older people are more aware of their bodies, and they don't discount the symptoms.
What age really should adults start scheduling colonoscopies? And does it make a difference if you're average risk as opposed to, say, I have a family history of colon cancer and I'm more high risk?
Well, it used to be the American College of Gastroenterology recommended everyone with average risk starting at age 50. But recently we've changed the recommendations to age 45. American Cancer Society also followed with this recommendation. People with increased risk, high risk, which is defined as first degree relative having had colon cancer at age 60 or less, they should start at age 40 or 10 years less than the index case. So if a family member had a colon cancer at age 40, then they should start at age 30 in screening.
And despite improved screening measures, as I'm sure, we've seen over the years, colon cancer does not treat everybody equally. What have studies shown about both age and racial disparities with colon cancer?
Regarding racial disparities, I think there are multiple hypotheses. There might be genetic factors, difficulty in accessing healthcare, discrimination. Physicians might be working on the patient who has multiple other more serious conditions, so they keep the colon cancer in the bottom of the list of importance. So there are multiple reasons.
And final thoughts or guidance that you would give to the community, to the general public about colon cancer. It's a scary thing to think about. And also, again, testing and really what you should do if you have any concerns about what's going on with you.
Well, colon cancer is one of the easiest cancers to prevent by screening. We have multiple avenues for screening. We have stool-based studies, such as the stool occult blood that takes a sample of stool and tests for just blood. There's also a test for stool DNA, for DNA of the polyps. Then the gold standard is a colonoscopy. Then there's also CAT scan colonoscopy. So multiple screening tests are available. And if you find a polyp during a colonoscopy, that can be removed at the same time. And actually, we're not really looking for colon cancer. We're looking for polyps, which are precursors for colon cancer.
Is there anything that you as a patient, when you're talking to your doctor, I mean, do you have a choice as to what test you receive then? Or is that really up to the physician to guide you in that way?
But physicians generally tend to guide the patients, of course. Patients have a choice. Some patients may not want to go through a colonoscopy. Then they're given the option of doing a yearly stool test for blood or a stool DNA test. So they have choice. But the gold standard is still the colonoscopy.
The bottom line, what you want to do is
Right.
to just make sure you're tested.
Make sure you're tested, and get tested early, and don't ignore any symptoms of abdominal change in bowel habits or abdominal pain. Don't think it's hemorrhoids. If you see some blood in the stool, don't think it's just hemorrhoids, because 2 or 3 years down the road, you might have something more serious.
Dr. Ouseph, thanks so much for joining us today and for your perspective. Important topic. Thank you so much.
Thank you.